All right, I want to welcome everyone to today's big announcement about the whole blood press conference here. We're really excited about the ability for our paramedics to have such a product to help the community. So I'm going to keep my words short. So thank you for coming. We've got a lot of distinguished speakers that were very influential in bringing this service to the people here in Ventura County.
My name's Scott Quirarte. I'm the EMS chief for the Ventura County Fire Department, and I want to first off thank you all for being here on what really is an amazing day, and really goes to prove just how great this county is, because this would not be possible without the ability of multiple disciplines, multiple groups, public, private, to come together and really amazingly improve patient care in our county. So again, this would not have been possible without our EMS division, County EMSA Agency, Vitalant, Ventura County Medical Center, all of these groups coming together for one common good and really pushing something that truly is, an amazing process that got us here. And I'll let them explain what happened, how we're here. And again, thank you very much. This is a great day for all of us. Thank you.
Thanks, Chief. I'm Edward Campana, firefighter paramedic with the County of Ventura and program manager for the Whole Blood program. I'm going to talk about two things. I'm going to talk about collaboration and I'm going to talk about dedication. So you see a lot of different people brought together from government and private entity to bring something that hasn't been brought to California to the table, and that's whole blood. Studies have conclusively shown that people who receive whole blood in the pre-hospital setting have a higher chance of survival, lower mortality and morbidity rates post admission to the hospital, and that the program has saved lives. This is conclusive evidence out there. And we, as a county, we saw a gap in coverage. We saw that what we were doing for our patients in traumatic cardiac arrest, as well as people who are in mass exsanguination secondary to hemorrhaging, have a real lapse in how we treat them. Giving them normal saline has been the standard for years in our county and really around the world. And we see that doesn't really save patients' lives. So as a county, we came together and we said, what can we do to improve our patients' care? And we saw that whole blood is kind of the gold standard in the military and now in the civilian world. So we took that, we brought it here, and we brought different entities together between government and private entity, and we sat down, collaborated, and we pushed this program forward. And that's something that's a really good example of government working for its citizens. Often today, we see people who bring ideas and they can be stopped at the gates of a large public entity. But I'm here to tell the citizens and to tell the people that your government and your fire department really care about you as people. Most of us live and work in this county, and we're dedicated to saving our citizens. We're dedicated to giving them the best possible treatment that we can. And this program is an example of that. It's an example of how we care about the people that we serve. And when something isn't to par for us, we're going to change that, and we're going to give you the best that we can. That's the collaboration aspect. The dedication aspect is kind of what I've already talked about a little bit. We care about the citizens and we care about treating them right. I'm standing here looking at people who have poured their hearts and souls into this program and want to see it succeed. The dedication is there, and I can make you a promise as a firefighter paramedic, but also as a person who lives here in this county and who has family in this county, that we will do everything that we can to keep you safe and to save your life whenever we get the opportunity and the privilege to do so. One person I want to thank in particular is Randy Schaefer. She's somebody who, whenever I was stuck and had a question, I brought it to Randy, and she has been absolutely amazing for us. So thank you, Randy. Last thing I want to say is thank you to everybody who's here today, people who spoke before me and will speak after me. They are committed to making this program work, and you have one of the strongest teams I've ever seen brought together to serve the citizens of Ventura County and the state of California. So thank you.
A little sun right in my eyes there. Good morning, everyone. Thank you for joining us here this morning as we formally announce our pre-hospital blood program. My name is Dr. Neil Canby. I am the medical director for the Ventura County Fire Department. I'm also a local emergency room physician. My responsibility as medical director is to ensure that the paramedics and EMTs of the Ventura County Fire Department provide the best care possible to the people of Ventura County. The addition of whole blood and a pre-hospital blood transfusion program will greatly improve the life-saving care that they already provide every day. Okay, thank you. Trauma is the fourth leading cause of death overall for all ages. Trauma is the leading cause of death for individuals under the age of 45, and hemorrhage is the most preventable cause of death in trauma. Data from both civilian and military studies show that the sooner you resuscitate patients with blood, you increase their chance of survival. Simply stated, the best way to save lives in trauma is to stop the bleeding and replace the blood with blood. This blood will also be made available for those patients bleeding for medical reasons, such as postpartum hemorrhage or gastrointestinal bleeding. Although 38 states in the United States allow the use of pre-hospital blood, as of 2024, only 1% of all EMS agencies in the United States actually carry blood. A little over a year and a half ago, firefighter Ed Campana, who spoke before me, returned from a national EMS conference where he learned about a pre-hospital blood program. He attended several lectures and was amazed at the results and the lives that could be saved by having a pre-hospital blood program. He approached me about going forward with this program and trying to establish it here. I'll admit, at first I was very skeptical, particularly knowing all the regulatory and administrative hurdles that we would have to conquer. But Ed was undaunted, and here we are today. We also didn't make this journey alone. We enlisted the help of some national experts. As Ed already mentioned, I'd like to especially thank Randy Schaefer again. She's a retired U.S. Army Lieutenant Colonel nurse who served 20 years as a nurse on the battlefield, and also works now at the Southwest Texas Regional Advisory Council, where she is a national expert on pre-hospital blood and was very instrumental in guiding us on this project. Working with the Ventura County EMS Emergency Medical Services Agency and a consortium of other EMS agencies, including Los Angeles, Sacramento, Riverside, and what's called ISMA, which is Inland Counties Medical Services Agency, which includes San Bernardino, Inyo County, and Mono County, we formed a Cal Drop group. As a group, we worked together to bring the whole blood to California. We navigated the administrative and regulatory process and were able to get authorization to provide the blood. Locally, we partnered with the Ventura County Medical Center and Vitalant Blood Services to procure the blood needed for this program. We are also collaborating with Vitalant to help organize blood drives to increase our local supply of whole blood. As we are moving forward with this program, we hope to expand this service to include other agencies within Ventura County, including the Ventura County Aviation Unit. Today, we are here to celebrate the fact that we now have this life-saving blood to offer to the people of Ventura County. We are one of only 3 agencies in the entire state to have a pre-hospital blood program. Like so many things we do, we hope we never have to use it, but the reality is we will. This blood will help us prevent someone from dying that doesn't need to die unnecessarily because of their injuries. And again, thank you for your attendance, and thank you to all the hard work of everybody else who made this program come together. Thank you very much.
So I am Daniel Shepard. I'm an emergency physician and medical director of the Ventura County EMS Agency. Blood transfusions for hemorrhagic shock date back to the 17th century. They're the standard of care of the hospital, and it was initially the military who brought this treatment into the field. Civilian EMS systems followed, and research from those systems have demonstrated that EMS blood transfusions are safe and effective. They not only have the potential to save lives, but they can hopefully limit the number of days that the patient is in the ICU and limit the disability they suffer as a result of their injury. The clinical evidence for EMS blood transfusions is convincing. However, the program would not be possible without the significant efforts of the Ventura County Fire Department, Ventura County Medical Center, and the cadre of experts and colleagues like Randy Schaefer who have provided encouragement and technical assistance. It's worth emphasizing that the blood the rescue ambulances are carrying is the same blood that would be administered in the hospital and undergoes the same testing for diseases, and the paramedics will follow strict protocols regarding the storage and administration of the blood. And these sort of guidelines, administration practices are in accordance with national guidelines and best practices. This program is being closely monitored by a quality assurance team who will continuously evaluate its safety and efficacy. Early in the 2010s, Ventura County EMS and its partner agencies designed and implemented a novel approach to treating patients in cardiac arrest. In 2017, Ventura County integrated a revolutionary treatment into its stroke specialty care system. The success of these programs relied heavily on the cooperation and collaboration of dedicated professionals from across the healthcare spectrum, this program is no different. I join my colleagues in expressing my excitement for the launch of this program, and I admire their dedication to improving the health and safety of Ventura County.
Good morning. My name is Dr. Lauren Sant. I'm the Deputy Trauma Medical Director at Ventura County Medical Center. I'm very pleased to be here with you all today. I want to start by thanking everyone involved who was able to really make this dream of pre-hospital whole blood a reality. Dr. Thomas Duncan, our VCMC Trauma Medical Director, who could not be here today but sends his warm regards, and everybody here standing to my right as well. Ventura County's decision to equip our pre-hospital providers with whole blood for trauma patients is not just a small change in our emergency medical system. It's a monumental development in our ability to care for the county's most critically injured. As a trauma surgeon myself, I know firsthand that every minute counts for these patients. And for years, paramedics in Ventura County have been able to do incredible work stabilizing patients en route. The introduction of whole blood will allow them to provide the most advanced care possible in these crucial first minutes after a traumatic injury. This could be the difference between life and death, and it's a difference that Ventura County's first responders are now equipped to make. This decision also highlights Ventura County's commitment to innovation, progress, and the well-being of its citizens. This county's forward-thinking approach to integrating whole blood into emergency response is not just a local improvement. It is also a model that other communities across the state will and may look for as they seek to enhance their own trauma care systems. Lastly, I want to emphasize that this initiative is not just about adding a new piece of medical equipment to the rigs. Just like the addition of tourniquets and TXA, it's about empowering our first responders with the tools that they need to make life-saving decisions in real time. It's about showing our commitment to the safety and well-being of every individual in Ventura County. And most importantly, it's about making sure that no matter the circumstance, we are always prepared to provide the best possible care to our community in its most critical moments. So thank you all again for being a part of this new era in trauma care in Ventura County.
Good morning. I'm Susan Noone, Regional Director for Vitalant. Vitalant is honored to be involved in this groundbreaking advancement in medical care in Ventura County. Vitalant is Central Coast primary blood collection organization, supporting over 25 hospitals, delivering over 70,000 life-saving units of blood every year. Donating blood saves lives. Every 2 seconds, someone in the U.S. needs blood. It's not always a trauma case or an emergency. It could be a little girl in the ICU or a mother with stage 3 leukemia. But when it is a trauma case, the speed of transfusion is crucial. That's why this program is so important, and it can only be made possible thanks to the generosity of volunteer blood donors whose contributions are saving lives every day. While type O is essential for pre-hospital transfusions, once that patient arrives at the hospital, they'll need blood that matches their blood type to continue their transfusion care. We encourage all eligible individuals to donate and support our community's blood supply. Over 60% of the population is eligible to give, yet of those who are eligible, fewer than 3% actually do give. Donating blood is easy, it's rewarding. The whole process takes about an hour, and in addition to having a donation center in Ventura, Vitalant organizes dozens of blood drives every week, making it convenient to give. In our community and beyond, the need for blood is constant, with hospitals relying on generous donors to save lives every day. Whether it's helping a trauma patient, supporting someone through surgery, or providing for those battling life-threatening illnesses, the impact of blood donation is profound and far-reaching. When you give blood, you're doing more than just giving. You're helping build a healthier, more resilient community for everyone. We congratulate Ventura County Fire Department on the launch of this life-saving program. Vitalant is proud to be a partner in this significant advancement in pre-hospital care in our community. Thank you.
So we are going to transition to the question and answer section as all the presentations have been completed so far. I would like to see if there are any questions from the media or the public for Chief Quirarte. Any questions for firefighter paramedic Edward Campana? Yes, Perry? I'm going to have Chief or Eddie. Do you want to answer that? Well, let's get it. Okay.
Yeah, that's a great question. Thank you for the question. The question is, are we going to expand into the Ojai Valley area? And the plan is yes. So the second phase of this program is looking to expand to the Ventura County Aviation Unit. So we'll have areas of the county that are lower frequency but higher acuity calls. And the Ojai Valley kind of fits into that sort of paradigm where calls may not be as frequent, but often when they come, especially in traumatic senses, they are very, very high acuity levels. So the plan is to expand to the Ojai Valley and to the Ventura County Aviation Unit, as well as any other areas that we see fit based on the studies in the first 6 months of this program. About 6 months. In the first 6 months of this calendar year, we'd be looking to do the studies and then expand thereafter. And I live in Ojai, so yeah, I want it up there too. Thank you.
Any other questions, Ray? So with that, I'm going to invite Chief Cook up as he's walking up. After his remarks, we'll be offering a demonstration, and the media and the public is welcome to come be a part of that to see how the blood is stored and transported, as well as how it is warmed up from a cold temperature to 104 degrees. Chief Cook?
I just wanted to take a moment on behalf of Fire Chief Dustin Gardner that I just wanted to tell everybody that what you see lined up here today is progress. And what you see is innovation, and what you see is the use of technology and a forward-thinking spirit. And on behalf of the Ventura County Fire Department, I want to thank all of our cooperating agencies, all of our partners, and especially EMSA. A lot of the things that we do are a partnership. We look for ways to innovate. We look for ways to have better service in our communities, and this is just one more example of that. One of the things that I think of when I was standing up here listening to all the speakers speak today, I was thinking to myself, wow, the people that live here in Ventura County should be smiling right now. I'm smiling right now thinking about the levels of service that are provided on a day-to-day basis here in Ventura County. I applaud everyone for their forward thinking. I truly look at all the things that come forward on a day-to-day basis, and we try to engage every level of that. And mostly it all surrounds around service. And I want to thank you for that. And I want to thank all of our partners for that, because they are always looking at new ways to provide service. With that, I want to say thank you to everybody. And like Andy said, we're going to have a demonstration up here. So please stick around, come up and look at this, and get firsthand knowledge on what we're going to be putting out there in the field right now for people that do suffer medical emergencies where whole blood will actually really benefit the victims here in Ventura County. So with that, thank you very much.